Friends, good evening to all of you. When I see so many people from pharma industry or pharma R&D or pharma business, I have a dream. The dream is one day one of you will make a medicine from molecule to the drug. Molecule to the drug. I feel if any one of you discover, you can lift your hand. Lift your hand. No, that's okay. I'm saying drug, that means started application. Okay? Very tough job. Molecule to the drug. That means you have to identify the molecule, then you have to see the gradients, and then you have to see that the medicinal value. Then your set of committees are there. All these fellows have to clear. Then you have animal test, human test, and multi-human test. It's a huge cost. Huge time and huge challenge. After all, it's time for India. You can go on doing something what others have done. But time has come. India has to become great. India has to become a great nation. And we will be told you are a great nation only if you can make from molecule to that drug. Particularly we have unique diseases. India, unique diseases, nobody else will discover drug for us. We have to discover our own molecule. Very challenging task, costly task, if time takes. But after all, problems should not become our captain. We have to become the captain of the problem, defeat the problem and succeed. So I wish all of you great days. One day I will come. I don't know when you are going to say, I have developed the drug from the molecule. It may be, my friend Ramaswamy said, there are newer routes are there because our Ayurveda area, people have got nearly for generations they have developed. If you capture from there, then the drug, then molecule to the drug could be simpler route you are studying. So friends, I am very happy to be by the side of Mr. Ramaswamy, Dr. Ramaswamy. He is one of the great innovator in leather technology, and Dr. Ramaswamy go together. He has made so many innovations. So I was very happy to sit other side Ketan, our friend Ketan Patel. Ketan Patel, Ketan means health, isn't it? Something to do with health, sir? Tell me, what is Ketan? Good health. Ketan means good health. So, you are all concerned about good health. Wish you all the best. First, I would like to greet my friend Ramaswamy, Dr. Ramaswamy, and then Mr. Ketan Patel, Milan R. Patel, Muhesh Gohal, and pharma industry leaders, and then pharma experts, research students. How many research students are there? Lift your hand. Research students, lift your hand. Boldly lift it. Research student, scientists, and distinguished guests, pharma innovation awardees also. I am very happy to meet all of you friends. Now, I am really delighted to participate in the PharmInnova award ceremony of Rajni Patel, V. Patel Trust, Ahmedabad. My greetings to organizers, award winners, and everybody. I understand the PharmInnova awards are given every year with an aim to encourage innovative thinking among the students pursuing their masters in pharma sciences. And also Sri Rajni V. Patel was one amongst the pioneers Indian pharma industry. And he has come from our own native way Today Indian pharma industry is the world's third largest in terms of volume, right? Third largest volume. There are about 100 US FDA approved manufacturing facilities in India and more than any other country outside the US, I understand. So you are having a good standing and a good record. The Indian companies file almost 20% of the abbreviated new drug applications, they call it under ANDA, to the FDA every year. I congratulate Sri Rajnibai V. Patel and what he has done now and his team for supporting innovation in pharma consistently and so effectively. What should I say to this gathering of pharma students and experts? I was asking myself. So friends, I have selected a very tough subject, but you should know. Drug-resistant bacteria and research challenges. Drug-resistant bacteria. We have a fantastic situation. We have got medicine, but it is resistant to bacteria. So, not resistant to bacteria. So, I have selected drug-resistant bacteria and research challenges as the title of my lecture today. For today, the day of innovation for all of you, for me also, which is recognized in pharma and appreciated. I would like to tell you, innovation is born out of cultural excellence, according to me. Any innovation, any field, every year I come to Ahmedabad to award grassroots innovations, grassroots innovation people. It can be fishermen folk, agriculture, from the laboratory, famous laboratories, and I find innovation, grassroots innovation, 200 grassroots innovation every year. So, but I want to tell you that I would like to tell innovation is born out of culture of excellence. Innovation is born out of culture of excellence. What is culture of excellence? Let us see what is culture of excellence, which I have experienced. Friends, you all belong to an organization, which stands for a culture of excellence. Excellence not by accident. It's a process where an individual or an organization or even nation continuously strives to better oneself. The performance standards are set by themselves. They work on their dreams with focus and are prepared to take calculated risk and do not get deterred by failures as they move towards their dreams. Then they step up their dreams and they attempt to reach the original targets. They strive to work to their potential. In the process, they increase their performance, thereby multiplying further their potential. And this is an unending life cycle of phenomena. They are not in competition with anyone else, but themselves. That's the culture of excellence. I'm sure every one of you in pharma industry assembled here will be endowed with excellence in thinking and action and leading to innovation and creativity. Now, I want to share with you, I have got a friend. His name is Professor Somaraju, and myself, my friend Arun Tiwari, he is here. Arun Tiwari, this fellow. We worked with Somaraju, Professor Somaraju. We developed what is called cardiac stent. You know, when we got 3 arteries, sometimes it gets blocked. Okay? When it's blocked, then heart problem all starts. So they were doing the open heart surgery and all those days. Now they don't do. So angioplasty they do nowadays. Put a cardiac stent. For given the 3 arteries, you can put cardiac stent. So we started developing that one. Went through various tests, medical, very tough area. You have to get the clearance. Goats you have to test, you have to get monkeys you have to test, so many things we did, then human test, multi-centric tests, all those things. Finally, we introduced to application of human being. When I met my friend, Professor Somaraju, I told him, I'm going to meet pharma people in Ahmedabad. And I was asking him, can you give me, he's a professional doctor, my friend Somaraju is a cardiologist and the chairman of a care hospital, and told me that over 50% of bacterial infection in Indian hospital are resistant to commonly used antibiotics. Very dangerous. Do you understand? And surveys show many widespread bacterial pathogens in India are also resistant to powerful broad spectrum of antibiotics. Very serious problem. I didn't understand till he explained to me. These bacteria could also resist hospitals' last resort intravenous antibiotics called carbobinums, and many of them are endowed with a super resistant gene which confers resistance to carbobinums along with at least 14 other antibiotics. Such bacteria have already found their way in drinking water supplies, and the prospects are indeed need research. I saw this audience, some of them research oriented. I must tell you, where are we heading? WHO, in this year report, 2014 report, on global surveillance of antimicrobial resistance reveals that antibiotic resistance is no longer a prediction of the future. It is happening right now, WHO report, across the world, and putting a risk at the ability to treat common infection in the community and hospitals. Without urgent coordinated action, the world is heading towards a post-antibiotic era in which common infection and minor injuries which are treatable for decades can once again create untreatable. But you don't get a lot. After all, there's a problem. We human beings, we become captain of the problem, defeat the problem and succeed, isn't it? All the way, you know this light what you are seeing? This light, the bulb you see. As soon as we see this light and bulb, we remember one guy. Who is that guy? Thomas, yeah, right, Thomas Alva Edison. You have to struggle thousands of ways to find the electricity application. But you remember him today. Similarly, a telephone, you have got a beautiful mobile telephone in your hand. But the man who discovered the telephone in 1880, Alexander Graham Bell, he designed the telephone for 1 minute transaction in his brain. He didn't have a laboratory. I went to his lab recently in Scotland. So friends, it is a very challenging task in the time of we have antibiotic situations. So friends, I was reading a book, Space Chronicles, Facing the Ultimate Frontier, written by young American astrophysicist Neil deGrasse Tyson. I met him once in California. He writes, what he writes, astrophysicist writes, you could also ask who is in charge of the cosmos. He is a cosmos scientist. He asked the question, who is in charge of cosmos? A lot of people think, well, we are humans. We are the most intelligent and accomplished species. We are in charge. Isn't it? We all feel we are in charge of cosmos. But this guy says, lot of think we are humans. We are the most intelligent, accomplished species. We are in charge. Bacteria may have a different outlook. More bacteria live and work in 1 linear centimeter of our lower colon than all the humans who have ever lived. That's what's going on in your digestive tract right now. Are we in charge? Are we simply hosts of bacteria? So you think about it, young fellows particularly think about it. It all depends on your outlook, as per a scientist, astrophysicist. It is indeed true that for the first half of geological time, our ancestors were bacteria. They come from there. Most creatures still are bacteria. Each one of our trillions of cells is colony of bacteria. We inherit every one of our genes, but we leave the womb without a single microbe. That's surprising, isn't it? As we pass through our mother's birth canal, we begin to attract entire colonies of bacteria. As long as you are with your mother, no problem. As we through our mother's birth canal, we begin to attract entire colonies of bacteria. By the time child can crawl, an enormous unseen cloud of microorganisms, 100 trillion or more, has blanketed the child. It's happening. But there are good bacteria, bad bacteria also, like human beings. Now, during my recent visit at the University of Edinburgh, last week I was there. At one place I saw Charles Darwin was there, Alexander Graham Bell was there, writer Stevenson was there, all have the students of that place. Walter Scott was there. So friend, during my recent visit to University of Edinburgh, I learned that in their hospitals, they say they use the term gram-positive bacteria, which are structurally vulnerable to antibiotics and disinfectants tend to dominate. In hospitals in India and other tropical countries, gram-negative bacteria, not gram-positive, gram-negative bacteria, which are encased in tough outer membrane that can repel antibiotics and antiseptics, are more common. We have a tougher problem. With most drug industry research and development focus on Western market, places like India will just have to wait for a new drugs for gram-negative, while the death toll from untreatable infection will rise. That's why when I see so many of you from India and Ahmedabad, you are assembled here, pharma people, our challenges are unique. The disease unique, the bacteria unique. So we have to become a unique people to find unique drug from the molecule. You have to be a unique people to find unique drug from the molecule. That is a big challenge we have. I understand that there is not much capacity of the kind of medical microbiological surveillance required to track the spread of antibiotic-resistant bacteria. Our disease surveillance program effectively collects information for only two of the country's 640 districts. 640 districts we have, only 2 district data we have. The bugs are not waiting for us to catch up our surveillance. They are merely going ahead. It is not that the end of antibiotics is somehow coming. Now, according to my friend, Dr. Grish Sahani, Director, Institute of Microbial Technology, Chandigarh, he says, survival of the fittest that holds good for men and animals and also holds good for bacteria, he says. He says, a majority of bacteria in nature are non-pathogenic. A large number of them live in our body, leading to symbiotic existence. A limited population of bacteria, which has become pathogenic, was also sensitive to antibiotics to begin with. It is the man-made antibiotic pressure which has led to the emergence of and spread of resistant genes among the bacteria. Despite the availability of a large arsenal of antibiotics, the ability of bacteria to become resistant to antibacterial agent is amazing. One side man wants to discover, another side the bacteria itself fighting. This is more evident in the hospital setting where antibiotic usage is done to maximum. Now friends, next. My friend, I thought it was a human problem. My friend Dr. William Dar, Director General of ICRISAT, Hyderabad, informed me recently The use of antibiotics is widespread not only in clinical medicine for human beings, but also in agriculture, aquaculture, and veterinary practice, poultry, even household products. Once the drug-resistant bacteria get into the food chain, the problem becomes very precarious for poverty-struck, weak and malnourished children and childbearing women. There is a grand reason that necessity of total ban on non-therapeutic use of antibiotics has not happened. The factory farm industry allied with the pharma industry has more power than the public and the professionals. What could be the vision of Indian pharma industry in such a complex scenario? I have given a very bad scenario. But I will now highlight something possible. The open source drug discovery is called OSDD. Program is a CSIR-led team, India consortium, with global partnership, with a vision to provide affordable healthcare to the developing world. Market forces discourage research-based pharma companies from developing drugs for infectious diseases that predominantly affect the developing world. This program, OSDD, has chosen TB as the first target disease. The current TB therapy was developed in the 1960s. The therapy is a combination of 4 drugs which has been administered under observation of a physician for 6 to 8 months. In India, an estimated 370,000 deaths due to TB occur every year. This amounts to over 1,000 deaths a day or 2 TB deaths every 3 minutes. This disease, which affects mostly our poor, is a huge problem for the nation. OSDD of CSIR aims to discover a better and more effective drug for TB by involving a large number of researchers based on open source philosophy. This is a software philosophy. The open source approach has been successfully adapted in software collaborative approach known as in science. OSDD's effort to do discovery, the open with the aim of collaboration, shared discovery makes it highly participative. It enables manifold expansion of resource for research. The next one. Last week, a friend of mine, this fellow, Arun Tiwari, brought him to Delhi, to my place. His name is Dr. Subramania Iyer. I thought he should go to some of the research minds, that's why I'm telling. Last week, Dr. Subramania Iyer came to see me from USA. He is a renowned immunologist. Immunology is one of the very important area of last year's discovery, immunology. A renowned immunologist, Dr. Iyer told me, carefully hear me, that birds are separated by 700 million years from mammals in the evolution of history and are therefore capable of making antibodies for almost any antigen which is unmanageable by the immune system of mammals. Subramania Iyer says, laying hens are highly cost-effective producer of polyclonal antibiotics in comparison with mammals, as the antibiotics can be purified from the egg yolk. The antibiotics are called IgY, immunology yolk, to differentiate them from mammalian IgY antibodies. Avian antibodies represent both the reduction and refinement in animal use. The cost of producing IgY is lower for mammalian antibodies, as chicken housing is cheap and the isolation separation process is economical, high yielding, and uncomplicated and fast. I would like to see some of the research to understand this. In the future, IgY, immunology technology offers a great opportunity to be more widely used in immunotherapy, diagnostics and research. Indian pharma industry can take a leadership position in this area and capture the entire emerging world market, estimated to be about $2 billion for treatment of only gastric ulcer alone. Now friends, with all those things, I want to tell you that what motivates finally a scientist to assemble here. But I will now share with you some of my personal experience and why some people give all the comfort and pleasure of their lives, pursue hard and difficult scientific pursuits. I have worked under the guidance of the truly great scientists like institution builders, namely Professor Vikram Sarabhai, Professor Satish Dhawan. I worked with the hundreds of brilliant scientists, engineers who gave shape to satellite launch vehicle, guided missile, nuclear weapon, and also developed countless devices that were denied to us by developed countries. They were all very passionate and selfless people. Most of them would have gone abroad and earned millions of dollars for themselves and their families, but they stayed back and contributed to the science that was more relevant to their situation. When I read about the life of Shri Rajini Bhai Patel, I thought about articulating what motivates a scientist. And I share with you today that with three motivators. One is gold, that is financial rewards. Second, ribbon, their reputational career awards. And third, puzzle, intrinsic satisfaction. My observation based on my interaction with thousands of Indian scientists is that many do science for reputational and intrinsic reason that financial reward play a relatively small role. Good example, my friend Kausam. Many young scientists are attracted to research for sake of curiosity, to hunger, to learn more, understand more, step out into unknown. The research, I believe it will make a difference to the natural environment, said young Isha, working computer science laboratory at JNU. I like to think that I shall take a different, whether it be now or in the future, she felt. Typically, research teams comprise postdoctors, graduate students, some of you are assembled here, researchers like that. It's very important that privacy of the scientist, self-motivation must be supported with broader mix of motives to include the social, affective aspects of intrinsic motivation. I suggest Indian corporate sector to encourage commercial engagement of scientists, support their reputational and the intrinsic motivation with financial security. Now I come to in conclusion friends, the most challenging problem of human civilization right now is that science is gathering knowledge faster than the society is gathering the wisdom. I read it. The most challenging problem of human civilization right now is that science is gathering knowledge faster than the society is gathering the wisdom. Since the time of Hippocrates, the history of medicine has been one of the ever most sophisticated phenotypes. These are the signs of diabetes, those that symptom of Alzheimer's disease. Medicine's ability to understand treat disease has hinged on this careful phenotyping of the patients. The convergence of, this is what you all the scientists to understand, the convergence of nanoscience, bioscience, information science and cognition science is called NBIC. Now it's a historic opportunity. Complete the symmetry of this equation by bringing genotyping to the traditionally phenotyping endeavor of clinical medicine. And while the complexity of this information is a barrier to the implementation, medical genetics and genetic counselors are well positioned to deal with the emerging volume of information, ensuring our relevance to medical practice. I have seen this happen in recent years with regard to pharma and vaccine. We are working together, we are improving access to medicine. Youth engineers, particularly for young pharmacists who are assembled here, also bear the additional burden of safeguarding ethics and moral values surrounding the work done within and outside our country. From sequence analysis to microarrays, unprecedented amounts of medical information are being generated which will soon directly pertain to patient care. My best wishes to all the PharmInnova award winners and also aspiring pharmaceutical students and researchers and all the pharma industry people who assembled here. May God bless you all, friends. My lecture, this lecture what I told you, it will be available in my website www.abdulkalam.com. Any question you can say. Wish you all the best.